Dr. Richard Gentile. I'm a board-certified facial plastic surgeon practicing in Northern Ohio, outside of Cleveland, Ohio. I've been in practice for 35 years. I first learned of ECAMS maybe several years ago from some colleagues of mine. They said that this was a really wonderful teaching opportunity and a great opportunity to see beautiful places like Italy. Initially, we start off with the didactic presentation in brief, and then we move on to the cadaver dissection. And the initial part is facelift and ancillary procedures, including buccal fat removal, lip lift, some skin rejuvenation, and some contemporary technology topics that I like talking about. We then progress on the next day to do blepharoplasty and other procedures, so it's a 2-day format. One of the things in the focus for our teaching is on the different types of procedures that go with facial rejuvenation and the facelift techniques, starting with subcutaneous to mini to deep plane, and with emphasis on deep plane and the extended deep plane. Our procedure is called the double deep plane. So you will learn, from a basic fundamental point of view facelifting topics to the most advanced facelift topics too. This permits the student and the learner, the lifelong learner, to kind of decide what level they're at, and also it ensures that there's something for everybody, whether you're a beginner or whether you're a very experienced person, so that the program will have information useful to all. During the cadaver dissection, the specimens are really, they're fresh and they've been frozen, and so you get a level of tissue appreciation in the cadaver dissection that usually you might not get at some meetings. So particular attention to that detail has been made. During that, there's 2 people to a station, and you have the constant teaching of the faculty during those phases. So for myself, 8 minutes of a lecture doesn't give me the same opportunity to teach as we do when it's a one-on-one situation in the cadaver dissections. So I'm very excited about the live surgery because, again, it's a very personal sort of opportunity for me to teach and for the students to be involved in virtually every part of the preoperative planning, the marking, the localization, and actually even be participating in some of the key parts of the surgery. For example, how to enter the deep plane in the face, how to enter the deep plane in the neck. So this level of teaching currently is not available, so it's a great opportunity to see wonderful places and a great opportunity to get the most current and contemporary teaching methods and learning.